welcome to today's Smart Mobility Connection seminar series. My name is Joy Mann, and I'm the Mobility 21 University Transportation Center Senior Administrative Coordinator. The Smart Mobility Connection series is sponsored by the Traffic 21 Institute and the Mobility 21 University Transportation Center as an opportunity for faculty to showcase their current transportation projects. It is also an opportunity for students, fellow faculty, deployment partners, and the broader community to engage and network with researchers, highlight opportunities for involvement, and foster future interdisciplinary collaboration. Please note this session is being recorded and all participants' microphones are muted. To ask a question, please send your question through the chat box. You do not need to wait to the end of the presentation to send your questions. Now I would like to introduce you to today's speakers. Dr. Megan Ryerson is a senior fellow at the Center for Injury Research and Prevention at the Children's Hospital of Philadelphia and a fellow at the Penn Center for Neuroasthetics. Dr. Ryerson is currently partnering with members of CIRP research team to explore transportation access and transportation demand to medical facilities for the elderly and those living with disabilities. She is a governor-appointed member of the Pennsylvania Department of Transportation Aviation Advisory Committee and is also a member of the Pennsylvania Department of Transportation State Transportation Innovation Council, the Board of Advisors for the Eno Center for Transportation, the Women's Transportation Seminar Philadelphia chapter, and she was appointed by the U.S. Secretary of Transportation and the Governor of Pennsylvania to aviation-related advisory committees. Under the leadership of Dr. Ryerson at the Center for Safe Mobility, Jasmine Siyu is a data analyst and a master's student and research assistant at the University of Pennsylvania. Please help me welcome Dr. Megan Ryerson and Jasmine Siyu to tell us about their University Transportation Center project, identifying community-level disparities in access to driver's education and training toward a definition of driver training deserts.
Hi, everyone. Thanks so much for having us, and thank you so much for that introduction. I'm going to go ahead and start. I'm going to go ahead and start with some of our slides. Lisa K. Joy, this looks good.
Looks great.
Okay, great. So again, thanks so much for having us. What Jasmine and I are going to talk to you about today is our research program and some of our specific research projects in the area of driver training particularly for teens. And we're interested in driver training at the intersection of mobility, safety, and equity, which we'll start to untangle and explain as we present. Thank you so much, Joy, for the introductions. I'd like to just introduce my team a little bit more. In addition to the things that Joy said, I'm the UPS Chair of Transportation and a professor in the Department of City and Regional Planning and Electrical and Systems Engineering at the University of Pennsylvania. Jasmine here to my right is a second-year master's student in the Department of City and Regional Planning at the University of Pennsylvania. And we also have a number of other team members and close collaborators. I'd certainly like to recognize Shausha Samardong, who is a lecturer in the Department of City and Regional Planning at the University of Pennsylvania. And then some team affiliates, some of whom are friends of the show. Josh Davidson is a PhD candidate in City and Regional Planning at the University of Pennsylvania. Alil Fegan, a research engineer, and Stephanie Nam, an undergraduate researcher here at the University of Pennsylvania in the Department of Economics. So I'm really excited to share my team, not just because we're going to highlight their immense contributions, but also it's really exciting to work on such an interdisciplinary team and everyone bringing their expertise to the table. The research that I'm going to talk about today is done in conjunction with the team at CHOP that has really built up an incredible research program on teen driver safety. The research in teen driver safety at CHOP, which is the Children's Hospital of Philadelphia, is incredibly extensive. And so I'm just going to highlight a small, I'm just going to highlight a team within it that we work the most closely. And this is the neuroscience of driving team. So I really want to take a moment and recognize everyone on this slide, particularly the PI, Dr. Flora Winston, who have really built up the infrastructure and the knowledge and the extensive data that I am going to reference herein. And I saw some people on the CHOP team in the participant list. So hello, everyone. So now that I've given a little bit of a background on the team, I want to just start with a framing of our team's perspectives, our team perspective, excuse me, and some of the complexities that we dive into when we're taking on our research. So at a very broad level, my research goals, our research goals are to help inform and evaluate policies at the federal level, at the state level, at the local level, with the goal of improving transportation safety while providing access to opportunity, particularly for those who need it most. To meet this goal, we have to take on the trade-off between safety, mobility, and equity. So policies to ensure safety and mobility, or policies to ensure safe mobility, can be an access restriction in the long or the short term. In a very physical way, we could think of we could think about blocking off a street that is a high crash location, right? It's a policy to improve safety, but it impedes access. These are the kinds of complexities that we really want to dive into, and we have to dive into to take on this topic. Another complexity that we really want to define and sort of wrestle with in our research is that a core concept in transportation, which is accessibility, we believe that we cannot measure accessibility in terms of just physical variables. Right. So in one of my classes, we spend time making accessibility maps, and these accessibility maps are defined by impedance, right? Maybe travel time and some kind of composite function of the pain, the physical pain it might take you to get to someplace. We really want to broaden the concept of accessibility to be both physical and a person's individual constraints, and how those constraints shape our really ability to access certain opportunities. So while this next slide certainly could deserve its own presentation because it's a study about accessibility that I worked on with my team and a colleague. What we did in this study is we tried to define two different kinds of accessibility, which are physical accessibility, which is the way that, the way that one's physical ability to access a destination differs across space, kind of agnostic of individual characteristics. And then experienced accessibility, which is the ways in which physical accessibility might be modified by underlying features of the population, right? So an example of this could be that we think about accessibility in terms of, particularly in the suburbs or in more rural areas, one's ability to reach a place with a vehicle. But if you are a person that has very unreliable vehicle access, right, or you lack income and means and your vehicle is very old and often doesn't work, do you truly have accessibility? With an automobile? So how can we layer on this experienced accessibility? Okay, so I'm going to really focus in here and start talking about driver education for teens and community level disparities in access to driver education. And I'm going to start with a little bit of a background and sort of the story of teen driver education, mainly because as a transportation planner and engineer, this was new to me as I really started to get into the topic. In the case that it's new to anyone, I'd really like to share this background. I should say Jasmine's monitoring the chat. So if anyone has clarifying questions, please, because I don't want to keep going on if there's some clarifying questions out there. Okay, so I want to talk about graduated driver's license laws in the United States and access to driver education. I want to start on the left. You may be aware that teen motor vehicle crash deaths are a significant public health issue. It varies by the year, teens crash at a particularly high rate, with many teens dying every day across the U.S. in traffic crashes. And there are also disparities with lower income minority teens experiencing higher crash rates than their higher income white teen counterparts, right? So we have this sort of public health crisis of crashes, and then we have these disparities in crashes. And one of the things to notice is that from the 90s to like 2005, you can see that the teen crash rate is not budging. It's like, especially for males and for females here, we have this sort of consistent rate that is not budging. And so during this time, two different sort of forces happened. One is that states began to implement graduated driver's license laws, starting around this time and ending in the 2005, 2006, not ending, they're still in place actually in all 50 states, but by about the mid 2000s, every state had them on the books. And what graduated driver's license laws do is that they slow down licensure by either requiring additional training before a teen can move to the next step of the process, and just effectively delay licensure. So let's say specific to the state of Ohio, which we'll see shortly is our sort of main case study location. In the state of Ohio, a teen might get their permit as early as 15 and a half or 16. But in order to move to the next steps and ultimately gain a full license, they have to engage in informal training with their families or with a licensed adult, but they also have to engage in formal training, which is classroom plus a behind the wheel with an instructor. Right. So we have these graduated driver's license laws being implemented during this period. And around 2006, we see a significant drop in teen crashes. Now, there's some really interesting, I think, really interesting debate in the literature about why teen crashes dropped after graduated driver's licensing. Certainly one explanation is the efficacy of driver education, right? The graduated driver's license laws are incentivizing teens to engage in formal driver education such that they can secure a license, at least I should say in the states where teens have to engage in formal driver's ed in order to get their license early. The other explanation is a little bit more nuanced, which is that graduated driver's license laws added another barrier for teens to get a license. And fewer teens are actually going through the process of securing a license, and therefore teen crashes are dropping. Now that idea of maybe getting a license is less accessible because a teen has to go through this kind of training is sort of somewhat supported by another force that happened around this same time, which is that the literature on the efficacy of driver's ed is very conflicting. And there have been studies that have come out in the 80s and the 90s that showed that driver's ed for teens did not lead to a reduction in crashes. And so this led to sort of a series of federal and state de-emphasis on driver education, which made driver education, certainly in some states and in some locations, less physically accessible. Fewer centers, fewer course opportunities, and so on. And also with less support, more expensive, right? So at the same time that we have the barrier of having to take and engage in driver education in order to secure early licensure, we have a de-emphasis of driver education at the federal and the state level. And I want to take a pause here because I think as a professor of city planning, as someone who's deeply concerned about urban transportation safety, pedestrian, cyclists, and also very concerned about the environment in my own research, I think a lot about how do we get people out of cars? How do we get people from stopping driving and so on? And, as I wrap up this introduction, what I'm really talking about is, well, there's a barrier to get people getting licensed, and we need to investigate these barriers. And that might seem kind of counter, or like I'm in conflict with myself, although I feel like that's part of my job as a professor on a daily basis. But the way that we are approaching this topic is that if the driver's license laws, coupled with the de-emphasis on driver education, are precluding certain groups, particularly more vulnerable groups, lower income groups, minority teens, and so on, from being able to access driver education and being able to secure that license, then these laws are a mobility equity issue that we need to seriously evaluate. And then the other thing I'll say is that where I'm sitting here in a very dense part of the state, and so possibly a driver's license means something different to a Philadelphia teen than it does to a teen in Ohio, where a driver's license could mean the difference between being able to participate in getting a job, in advanced educational opportunities, right? Right, so there's significant, I think, access to opportunity, and these mobility equity issues related to securing a license. So, I just received a question of, do public high schools offer driver training, or do students have to find a private provider? There are public high schools that offer driver training. There are fewer, from what I understand. We're still kind of untangling some of this, and it's also very state by state, but there are fewer centers. There are fewer centers in, fewer schools that offer it, and it still comes at a cost, and in my understanding can come at a relatively larger cost just because of the de-emphasis. Another thing I'll say, and this is the complexity we have to get into, a lot of cities, I mean, from Philadelphia to Columbus, Ohio, offer school choice for public high schools. And so it's actually really hard to match up a teen with their school because teens can go to school all over. So it's sort of a challenge to unravel who has access to driver education in their school. But this is an area of storytelling. I think storytelling has a lot of power. I think driver education is very different from when I was growing up compared to when some other people on the call who maybe took it much more recently. And it's an area that's evolving, sort of the landscape is evolving very quickly. So we're going to talk about our study of accessibility to driver training, right, towards defining what we're calling driving training deserts. We are going to focus on Ohio for reasons that will become evident in a moment. And it's just important to note that Ohio's graduated driver's license laws require in-person behind-the-wheel training for a teen that wants to secure early licensure, right? So that before 18. If a teen wants to get a driver's license before 18, they have to take behind the wheel training. And I like to specify that because a teen, I like to specify that because a lot of states are experimenting with online virtual classes for the classroom component. So a teen might be able to take virtual driver education classroom. They still have to physically access the behind the wheel driver training. So that's what we're really going to focus on. We hypothesize that for teenagers, obtaining a license might be challenging because the behind-the-wheel training facilities can be spatially and financially hard to reach. So we are going to investigate accessibility to driver training at different scales and its impacts with the goal of defining driver training deserts and geographic areas of disconnection to driver training. So we're like very, very privileged to use Ohio as a lab, we're very, very privileged to use Ohio as a lab, and the CHOP team that we're working closely with has a very strong relationship with Ohio, from the DMV to the DOT to the Ohio Department of Public Safety. The sort of short story is that the CHOP team worked very closely with the state of Ohio and was able to implement CHOPs and diagnostic driving's virtual driving assessment in Ohio DMVs. And it has a lot of complexity in it, but in short, it's like a driving simulator. If you've ever been in a driving simulator, and a teen or anyone is given the option of engaging in the virtual driving assessment before they sit for their roadway exam. I'm forgetting the number of observations, but the CHOP team has an extensive number of operations of teens who have gone for licenses and opted into the virtual driving assessment. And while there is so much data, what we are going to focus on from this data set is that we have limited personal data like sex and age and home census tract. We also have a flag of if the teen completed driver education, right? And so that's really what we're going to focus on. So kind of picture that database that we have. From the Ohio Department of Public Safety, we received publicly available data on the locations of, we have publicly available data on the locations of driving training centers. And, from the publicly available ACS of the United States US Census, we have tract level socioeconomic variables, vehicle ownership, population density, poverty rates. And also because of this, we we were able to calculate the distance. Okay, it's a track level distance, which we'll get to, but calculated distance and travel time to the nearest behind the wheel driver education facility. So I want to make two clarifications. I'm loving the real-time chat. We have over 35,000 who have completed the virtual driving assessment in Ohio. So just an incredibly robust data source. And I also want to mention something that we're going to come back to are these two levels of data. We have individual data from the virtual driving assessment, but because at this phase, we have their home at the census tract level, we're going to define people based on who they are as an individual, but also the census tract they come from. And so the census tract is where we have socioeconomic variables and also distance variables. At this stage, we're doing the best we can with those variables. Moving forward, we're working towards getting more granular, more granular data. So stay tuned for that. As I said in the beginning, this is what we're presenting is all part of a much broader research program. We're going to talk about two studies that we did under this broad research program. And the first is about identifying community level disparities in access to driver education and training. And the second is diving into the details of who took driver education, who didn't, and what are their characteristics, and are there sort of systematic differences in who takes driver's ed and who didn't. So the first study is absent the flag of who took driver's ed and who didn't. It's really just looking at accessibility, cost, and SES, or the economic status of different census tracts. And then in the next study, we really dive into who took driver ed and who didn't. So I shared that we're working in Ohio. For these two studies, we took the further step of really diving into Columbus, the Columbus statistical area. Columbus has urbanized areas, suburbanized areas, ex-urban and rural areas. We thought it was a really nice geographic area. A really nice geographic area for us to study, as well as a large diversity of income and a large diversity of income and other measures. And so just to get an idea of what Columbus looks like, the red dots here are these behind the wheel driving learning centers. And the map on the right shows the population density, right? Not surprising. It's significantly more dense, like right around the central area of Columbus. And then there's a few like suburban centers that pop up and have higher density, and then certainly areas of low density. I'd like to note the blue dots here are the red dots here. These are the behind the wheel driving. These are the behind the wheel driving training centers. We kept these outside of the MSA because, I mean, when we make choices, we don't necessarily, not cross the boundaries of our statistical area. Someone who lives here might find this to be more accessible than this, or so on. And so we went through some, spatial analysis and mapping to make sure that even if a learning center was outside the MSA, we included it. So just a little bit more about the area. We looked at the variation in household income, the variation in access to vehicles, a few areas with, there's a few areas, 88% is not low vehicle ownership in a place like Philadelphia, but in certainly in a place that's much more suburban, exurban, rural. We have this, 90 to 88 to 90% vehicle ownership, renders at least 10%, of the census tract population without a vehicle in a very low, in an area that has very limited transit access. I will also say that for time, we're not going to show the transit and the walking maps. We did dive into that as well to look at people's accessibility to driver education locations in with public transportation. And at least in Ohio, it tends to be very, very long amounts of time. Okay. So Jasmine's going to talk about how we took a look at the driving training centers and asked the question of, are they clustered in the region?
Yeah, so when we first got the data, we were interested in the spatial distributions of this driving training centers. And whether the distribution is related to some underlying factors such as population density or median household income. So we firstly did the homogeneous K function, is to test if driving training centers are spatially clustered. As you can see on the right figure, the theoretical K curve and its significance band represents spatial random distribution. And our observed K curve is way above the significance band. That means the driving training centers are spatially clustered across the metropolitan area, and this clustering is statistically significant. Next, please. Then to account for some underlying factors that may influence the distribution of driving training centers, we did inhomogeneous K function. This allows us to use different variables as the underlying intensity layer in K function analysis. For the instance of median household income, as shown on the screen, what we found is that the clustering is still significantly present. Similarly, we have the same findings for both population density and vehicle ownership. With that being said, the clustering of driving schools is even more intense than these socioeconomic variables can explain.
All right. So we understand that our behind the wheel centers are clustered. Some of that can be explained from socioeconomic variables, and some of it is just really intense clustering. And so our next step was to say, on a census tract by census tract basis, how do people have access in terms of time and cost to these behind the wheel driving centers? So what we did was we identified census tracts that have relatively high travel times and relatively high poverty rates. Relatively high travel times to travel to a behind the wheel center. The rationale being that if you have to traverse a long distance and you have to pay a lot, right? You're facing, if you have to traverse a long distance to get to a behind the wheel center and you are experiencing poverty or relatively low income, that those two things together could represent your impedance to accessing a behind the wheel driver center. So we used spatial methods and sort of cut up the census tract into very small locations. I'm going to present results that represent the average driving time across every little location within a census tract, the average driving time to a behind the wheel center, and identify those census tracts that have high average driving times to a behind the wheel center and have relatively high poverty. So on the left, we see our results with our with our census tracts that are high poverty and have relatively high travel times to a behind the wheel training center, highlighted in red. We see it's really a mix between these small, much more urbanized census tracts and census tracts that might be considered out in the exurbs or the rural areas. So first of all, one of the things we thought was interesting was how spatially diverse these locations are. And another thing that we certainly thought was notable was that the racial composition of these census tracts is not necessarily reflective of the racial composition of the entire MSA. If we classify driving training deserts in this way, we have the racial composition of those living in driving training deserts being 26% African-American compared to 15% across the entire MSA. So, while we're here, we're just making breakpoints and trying to identify areas of high impedance. It appears that we have evidence of driving training deserts, and also that there's, some inequitable access, and there's some inequitable access, and it might be harming certain groups, vulnerable populations, minority populations, and certainly low-income populations. Lisa K. Lisa K. You mentioned, do high schools account for this? We actually go into a sort of long discussion of how we dealt with driver's ed in high schools in our paper that's about to come out. I look forward to sharing it. I look forward to sharing it with you. I mentioned matching teens with their high schools. Behind the wheel training is very, is very challenging. I also got the question of, is it correct that behind the wheel financial cost is the responsibility of the parents? I think that varies, from family to family, how people do their finances or expect their children to pay for things or not. But that's also why we use the poverty rate, in the sense of, we're not necessarily we're not doing qualitative research, so we can't ask people how they paid and how they view the cost and so on. But we can say that you live in a census tract with a relatively high poverty rate. And so we're going to use that as a proxy for you having constraints on your income, whether it's the parent having constraints, the kid having everyone having constraints. So it's more of a conceptual constraints of being of, much more modest, low or poverty income, or not. Okay. So let's move a little along here and add the layer of the individual data here. So now we say, okay, we think we identified the existence of driving training deserts. And now we want to look at the individuals, the teens who said they took driver's ed, and the teens, particularly older teens, who delayed licensure and didn't take driver's ed, right? What are their characteristics? And can we learn from their characteristics about any inequities here about who gets to access driver education? So let me just say a little bit about our framework here, how we started to answer this question. I mentioned the databases that we used. We put these databases all together. So we have our census data, we have our driving school location data, and then we layered on the virtual driving assessment data, which again, we're really just interested in. Did you take driver's ed? What do you identify as your sex and your home location, which then home census tract, which then we matched to the census data, and also identified their sort of closest behind the wheel driving school, so we could identify that distance. When we put these data together, we have data at what we call two levels. we have individual level variables, right? We have this driver education and sex. Those are our two individual level data points. And then we have this census level data, right? Percent of population below the federal poverty level, households with vehicle, even travel time to the nearest behind the wheel driving school is a census level variable because we don't have these home addresses yet. So Jasmine worked on, researched, and is going to explain the use of multi-level logit modeling to account for the fact that we have data on different scales.
Yeah, so as you can see from this diagram, there are clear two levels in our data. The first level is also the unit of analysis is individuals. And the second level is their home census tract. So
yeah, go for it.
So a way to deal with this data, multi-level data structure is to do multi-level / hierarchical logit regression. This modeling method allows logit regression to have a hierarchical structure where we have study subjects clustered in higher level units, and the subject outcomes are associated with multi-levels characteristics. Think about the structure of students, classes, and schools. Students in the same class may tend to be more alike in their physical and mental performances than individuals chosen at random from the population at large. So this may be due to some known reasons like enrollment processes, or some unknown reasons, what we would call them random effects. So yeah.
Sure. So I'll just say very briefly, using a multi-level model, we are going to predict this, in this binary logit formulation, if somebody engaged in driver education or not. And we have different descriptors. We have the individual level variable, which again, all we have is sex for our individual level variables. So we have that here. And then we have the census tract variables. And I'd like to note that we didn't just enter the census tract variables independently, but we also interact our variables. So for example, we multiplied the travel time with the poverty rate variable and included that in the model. And the reason is that I'm interested in how different income brackets sort of experience or overcome a long travel time to a behind the wheel training center. And I wanted to catch that interaction. And so that's what we did here. It is 12:45, so I'm going to show the results. It's 12:45, so I'm going to show the results relatively quickly. A few things that I want to say here. Again, we're predicting if somebody takes driver education or doesn't, with taking driver education being the sort of positive outcome. So certainly we see that in general, the further somebody is from a behind the wheel center, they're less likely to take driver education. We also see that as sort of poverty within the census tract increases, or census tracts with the largest, census tracts with the, the largest sort of percentage of the population living in poverty, they are the least, teens from there are the least likely to have engaged in driver education and early licensure. So there's certainly something happening, and there's certainly something happening relating income with the propensity to take driver education and secure early licensure. And actually, we looked at the poverty rates as quartiles, and as we go down in quartile, in the sense of as we look at census tracts that have more and more poverty, we are less and less likely, it's less and less likely that a teen from these census tracts engages in driver's ed. So there certainly seems like something, structural there. Sort of moving down from there, when we interact the poverty rate of a census tract that a teen is from with the travel time, we see a slight effect that teens from the lowest poverty, teens from the highest poverty areas are somewhat least likely to be affected by the travel time. And so let's say it this way: a teen of higher income with a long with a long travel time to a behind the wheel center might be more likely to say, I'm not going to take driver's ed because it's really far away, compared to a teen from a census tract with very low income. This seems somewhat unusual, and like we really had to unpack this result. And the things that we're thinking of related to this finding are as follows. One is that travel time is a proxy for urbanicity, and this idea that teens, particularly lower income teens in the more rural areas, they have to drive farther to get to a behind the wheel center because they live in a rural area. And that's just the way that it is. And it's in their mind that they have to drive far to places because they live in a more rural area. So it's more of a function of like land density and so on than it is of a low income teen kind of not being affected as much by travel time. Another interpretation is that lower income teens in rural locations need to get a license so badly because they need a car, or access to a car, I should say, in order to engage in, education and jobs in a different way than their counterparts that live in a more suburban or in a more urbanized area. Whether this is because their sort of higher income counterparts can more easily get a ride, or their higher income counterparts can more easily get a ride from family. These are these sorts of nuances that become hard to parse out with just data, but these are the kind of explanations that we are working towards untangling. So we are currently very much in the process of that, and we're currently very much in the process of doing that. And one of the ways that we're doing this is that instead of using our multi-level model, where we have individual effects and census level effects, and we're merging them together, we are just looking at outcomes on the census tract level and using a dichotomous dependent variable such that census tracts are defined as the number of teens that take driver's ed and secure early licensure and the number of teens that don't. And so we kind of have this score that's like a wins and loss score. And then we can use our predictors. Our predictors can be a wide range of census variables that describe the population in the census tract. This method is called the beta binomial regression method. I think it's very powerful, especially for those of us doing urban research and thinking about things on a census tract level and, you know, yes, no, and so on. I think it's a really interesting method. Jasmine and I have been learning it. A lot of the teaching is related to baseball, in the sense of you want to know a batter's both hits and misses, not just their hits, to evaluate if a batter is a good batter or not. So I think this is a really relevant method to answer a lot of questions in transportation. And while we don't have results that are sort of ready for prime time, our very initial results seem to confirm our thinking that for lower income Ohioans, travel time to behind the wheel training really ceases to be an important predictor of whether or not this teen enrolls in behind the wheel driver education. And to me, this indicates that lower income Ohioans, they are seeking out mobility regardless of constraints or challenges. And I want to bring it back to one of the first things we talked about, which is like access and equity and constraints and so on. When I see a result like this, I think it's has to overcome a lot of constraints to access this behind the wheel training and, you know, and pay for it and repeatedly access it. And so in saying that, or in finding that travel time isn't a key predictor, it doesn't mean that they don't value their time or that it's not sort of a painful thing for them to take on. Just means that they really need that mobility. And so they are overcoming it in ways that could be particularly challenging. I personally, I think this motivates significantly more research, of course, but also qualitative investigation, right? This is something, you know, as planners, we're really interested in. How can we really collect qualitative data to bring some of that nuance in our findings out? Of course, we're researchers, so we're always looking for more and more data. We're so grateful to our team for constantly refining and collecting more and so on. So we really think this is just the beginning of being able to unravel what is a driving training desert and how does it relate to a teen's propensity to engage in driver education. Thank you so much for your attention and so on. I'm really looking forward to the discussion. I received a question of, you know, do we think that teens are overcoming the costs because, you know, there are insurance costs of, you can lower your insurance if you get trained by the, so, right. So it's kind of like we're trading costs. That's certainly a possibility. I think an important nuance. And sometimes I feel like in research, right, we find all these phenomena and explain them, and then, you know, realize it's some other driver of behavior that, you know, we didn't think of. And it is possible that insurance is a cause here, and that's a really interesting point. I do think that the concept of a driving training desert is certainly a new one, and it's born out of, you know, the idea of a food desert, a transit desert, and so on. I like to think about it as the intersection between being physically distant and also having to overcome those constraints of cost in order to access the driver training. Are there other questions?
I don't get any.
Okay.
I do not have any other questions either. So thank you very much, Megan and Jasmine, for sharing your work. And thank you to all of today's attendees for joining us. As I mentioned earlier, today's presentation will be posted on the Mobility 21 What's Happening page of the website, along with a link to the video of the session. This afternoon, you will be receiving an email asking you to take a short survey about today's SMC. Please take a few minutes to provide your feedback. For students who are interested in engaging in transportation topics, the Transportation Club on campus is a great way to plug into transportation topics with fellow transportation nerds. Our next SMC will be on Friday, October 7th. Please watch for your invitation to join us closer to that date. And again, thank you for attending today, and please feel free to contact us with any questions.
Thanks so much.
Thank you.
Thank you.